Liraglutide, and the review of liraglutide to assist Amy's weight loss journey. Hi, my name is Luke McDonald, and today I'll be analysing the drug liraglutide and whether or not it is a suitable drug to assist Amy losing weight. And how it works. Liraglutide is an injectable glucagon-like peptide 1 receptor agonist. It was approved by the US FDA in 2010 in order to improve glycemic control in adults who have type 2 diabetes mellitus. Type 2 diabetes is a common and progressive metabolic disorder that is characterized by insufficient insulin production and is typically associated with defective insulin action. Liraglutide decreases high glucagon secretion in glucose-dependent fashion. That is, the drug works to block the effects of glucagon on hepatic glucose output. Similarly, when liraglutide is present, as the blood glucose concentration decreases, the secretion of insulin diminishes and blood glucose concentration reaches a normal level, achieving euglycemia. Liraglutide also produces a delay in gastric emptying, which reduces hunger and lowers the energy intake. Thus, it aids in decreasing body weight and body fat mass. These functions make the drug highly beneficial to patients with type 2 diabetes. The drug and how it was discovered. The drug is administered to an area that has a layer of fat between the skin and the muscle. That is a subcutaneous injection in the abdomen, thigh, or upper arm. It is administered once daily at any time and without regard to meals. Typically, the starting dose is low. This is in order to reduce the risk of gastrointestinal symptoms, and at this stage it is not effective for glycemic control. After 1 week, the dose of liraglutide should be increased to improve glycemic control. Incretin hormones play an important role in glucose homeostasis. GLP-1 is an endogenous incretin hormone produced by intestinal cells. It has a major function in the maintenance of normal blood glucose concentration and allows insulin secretion from the pancreatic B cells when glucose is taken orally. Human native GLP-1 has the potential to treat patients with diabetes. However, it has a short half-life, around 1.5 to 2.5 minutes. Therefore, it would only be effective for clinical use if given continuous infusions. As a result, in order to overcome these limitations, liraglutide was discovered and developed for use in the treatment of patients with type 2 diabetes, as it is a longer lasting and acting analog of GLP-1. The proposed mechanism of weight loss that liraglutide offers is that it provides effective glycemic control and improves pancreatic B functions that ultimately lead to weight loss. Liraglutide is a derivative of GLP-1. It is used as a treatment in diabetes and obesity through reducing hyperglycemic and induced weight loss. Liraglutide causes a glucose-dependent stimulation of insulin secretion. It reduces plasma glucagon concentration, delays gastric emptying, increases appetite suppression and heart rate. The increase in appetite suppression and the delaying of gastric emptying has found to be responsible for weight loss effects of GLP-1. Liraglutide is an agonist of the glucagon-like peptides 1 receptor, which is coupled to adenylate cyclase label. There is an increase in the glucose-dependent release of insulin due to the increase in cyclic AMP, which in turn inhibits glucose-dependent release of glucagon. This also slows down the gastric emptying to increase control of blood sugar. The effects on our normal digestion and metabolism. When it comes to metabolism, liraglutide is less sensitive than GLP-1, which means it is more slowly metabolized by dipeptidylpeptidase. 4.6% of liraglutide is excreted through urine and 5% through feces. There have been several studies conducted to assess implications of liraglutide on digestion and metabolism. For example, Dr. Nealon from the National Institute of Diabetes and Digestive and Kidney Disease conducted 5 randomized placebo-controlled trials of liraglutide for weight loss management. In addition to recommended diet and physical activity, liraglutide consistently resulted in a 4 to 6 kilo weight loss, with a greater proportion of patients achieving at least 5 to 10% weight loss compared with placebo. Following up on that research conducted by Dr. Nealon, he found that overall liraglutide was a relatively safe drug and well-tolerated weight loss agent. However, there are several side effects linked with liraglutide. The side effects that were reported by the patients included: over 10% of the patients have presented gastrointestinal discomfort, nausea, vomiting, and diarrhea. From 1% to 10% of patients developed upper tract respiratory infections, headaches, and high levels of anti-liraglutide antibodies. Even though their side effects were not severe, Dr. Nealon recommended liraglutide should be used cautiously in patients with impaired kidney or liver function, but has been shown to be safe and did not affect kidney function in patients with moderate renal impairment, and that patients who are starting to use liraglutide be aware about risks of acute pancreatitis, acute gallbladder disease, serious hypoglycemia, heart rate increases, hypersensitivity reactions, and suicidal behavior. There are no specific foods that you should avoid while on liraglutide. However, there are diet recommendations for people with diabetes, and these include light foods that include vegetables and fruits, protein-rich foods, rice, potatoes, pasta, bread, and other whole grain foods, and reduced amounts of high fat and sugar food and drinks. Liraglutide has the potential to cause disease. It was scientifically proven in studies with rats and mice that C-cell thyroid tumors were caused. Although it was used on over 6,000 patients with no increased risk for MTC, the risk remains. Therefore, humans with family or personal history of MTC or MEN are advised not to use it. In addition to this, patients who are starting liraglutide should also be warned about the increased risks of pancreatitis, acute gallbladder disease, increased heart rate, serious hypoglycemia, and suicidal behavior. Although the use of liraglutide can cause these serious issues as well as disease, there is also evidence that it can reduce the risk of disease. The disease such as cardiovascular disease is prominent with type 2 diabetes patients. There have been numerous benefits when using 1.8 mg formulation in reducing the risk of cardiovascular disease. However, the effects of 3 mg formulation on cardiovascular disease are not yet known. In addition to this, liraglutide has not yet been tested on a wide enough variety of ethnicities and races in the long term to determine long-term effects on eliminating cardiovascular disease. The actual cause of weight loss, in simple terms, is that the drug works on our brain by sending signals to tell us that we are feeling full, which decreases hunger in the brain and in turn makes patients eat less. This leads to eating less calories and losing weight. That is, if the patient is expending more energy than they are consuming. The primary objective of the test was to see the long-term clinical effectiveness of liraglutide for weight management in patients who suffered from type 2 diabetes. The primary efficacy outcome measure was if there was any change in the baseline weight after 60 months of treatment, and what proportion of the participants had a relative weight loss, which was set at 5 or more than 5%. The primary outcome was to test the long-term clinical effectiveness of liraglutide for weight management in our patient cohort with T2D. The primary efficacy outcome measure was that the change from the baseline in body weight after 60 months of liraglutide treatment and the proportion of participants with relative weight loss at below 5%. The test found that the loss of weight observed during the first 6 months of therapy was maintained throughout the 5-year study. Therefore, liraglutide does have long-term weight loss effects. Essentially, prolonging treatment with liraglutide can lead to sustainable benefits in relation to weight loss. The study has also found that once you stop using liraglutide, you are likely to gain back the weight that you lost, and therefore it is vital to learn how to diet and exercise during the use of liraglutide in order to maintain the weight you have lost if you decide to stop using it. My recommendation is that if Amy is keen to lose weight quickly, that she should use the weight loss drug liraglutide to help her. As Amy has no known medical history or conditions, this drug is a safe option and unlikely to cause any serious disease or permanent damage. Furthermore, this drug, when used with dieting and exercise, will be highly beneficial in combating quick weight loss. This drug will assist Amy to feel full more of the time by sending certain signals to her brain, and this will lead to her eating less calories. By eating less calories per day, Amy will increase her chances of losing weight quickly when ensuring that she is consistently expending more energy daily than she is consuming. I have come to this conclusion due to the scientific testing that has been done by Dr. Nealon on this drug and the minimal adverse effects it has on its patients without medical history or known conditions. As stated by Dr. Nealon's scientific study, this drug, when used with recommended diets and exercise, is far more effective than in comparison to the use of placebo. These results confirm the positive effects of liraglutide on losing weight, as the drug consistently resulted in a 4 to 6 kilo weight loss, with a greater proportion of patients achieving at least 5% and 10% weight loss compared with placebo. All the best, Amy. I wish you a successful weight loss journey. Thank you very much for listening.